Concern over a mutated, fast-spreading strain of the coronavirus identified recently in England caused travel chaos in the country over the weekend and has prompted several countries to suspend travel to and from the country. Health officials in the United Kingdom say modeling estimates suggest the variant is up to 70% more transmissible and may be responsible for a rapid increase in COVID-19 cases in southeast England in recent weeks. Concern about the spread of the variant led the Prime Minister Boris Johnson to impose Tier 4 restrictions, the country's strictest coronavirus measures, in London, the south east, and east of England over the weekend. The lockdown in London resulted in crowds of people rushing to the city's train stations to leave before the new restrictions went into place yesterday morning. The restrictions make it illegal to leave the city unless for essential travel. European countries quickly responded to the news, with France, Germany, Italy, the Netherlands, Austria, Belgium, and Ireland among the countries moving to block travel from the United Kingdom. Today, they were joined by dozens of other European countries and nations in Latin America, the Middle East, according to CNN. France also suspended freight transit across the English Channel, leading to the closure of several UK ports. Johnson and his cabinet members are holding an emergency meeting today to discuss the travel restrictions, and European Union leaders are planning to meet to devise a common doctrine for dealing with the threat of the variant. The New York Times reports studies of variant underway at today's COVID-19 media update. World Health Organization (WHO) officials addressed what is known so far about the UK variant, which contains several mutations of the spike protein in SARS-CoV-2, the virus that causes COVID-19, that were identified through genomic sequencing. WHO COVID-19 lead Maria Van Kerkhove, PhD, said the variant, identified by UK health officials as the B1.1.7 lineage, was reported to the WHO on December 14 after an epidemiologic investigation by UK scientists of cases in the southeast of England. In a statement today, the WHO said 1,108 cases involving the variant have been identified as of December 13. Most were in people younger than 60. Van Kerkhove said UK scientists are currently looking at differences in the variant's ability to transmit, whether it causes more serious disease, and if it affects the antibody response. She explained that the reported increased transmission of the variant is indicated by an observed increase in the reproduction number, the number of people that one infected person can transmit the virus to, from 1.1 to 1.5. They're trying to determine how much of that is associated with the variant itself, as well as behavioral differences in individuals that this variant has infected, Van Kerkhove said.